It's been 43 days since Saskatchewan announced its first case of COVID-19 back on March 12th. Now we're 10 days from the first phase of the government's reopen plan. CBC political reporter Adam Hunter joins me now. A lot of news to go through on a Friday afternoon. Adam, what stands out to you?
Well, it is a huge news day as far as COVID-19 in Saskatchewan goes. We just had the reopen plan announcement yesterday. We went through that in great detail. We had Premier Scott Moe's message on Wednesday night to the province, and today, late in the afternoon, the province announcing, as you've mentioned, the travel ban to northern Saskatchewan. It's a huge swath of the province, basically Prince Albert National Park north. Just a huge area to be through a travel restriction right now because of that outbreak in the north. And as we know right now today, the far north having more cases, active cases, than Regina and Saskatoon combined to the province working on that. That's one thing that stands out. The other thing that stands out to me today is the province's messaging, Sam, that there's been a little bit of confusion over the last few days about what you can do. Can you go see a friend? Can you have a barbecue? Can you go visit your parents? Or if you have a newborn in your family, can you see them? So some people have been visiting through this and just practicing physical distancing, hand washing, things like that. Others have been isolating at home and being very, very careful. But as we know, those cases are dropping down, the number of active cases. So those are the two main things, just the messaging on what we can and can't do and what we should and shouldn't do. And also the big news today, which is the travel restriction in the far north.
But Adam, 2 weeks ago today was Good Friday. We were told not to have Easter with our families. So the messaging has changed pretty significantly, even just in the last 2 weeks.
Yeah, even today, Sam, honestly, we had Premier Moe on both of our morning shows. He was asked about this, and then earlier this afternoon there was a new set of guidelines, or maybe a clearer set of guidelines, let's say, from some of the messaging that came out of yesterday's press conference, where Premier Moe said he missed his son and was going to have a barbecue with him very soon. And Dr. Shahab said, maybe pick one or two households to link up with, but keep your contacts low. Some people saying, make sure you know who you've connected with over the past couple of weeks. So if you do come in contact with someone or you test positive yourself, that you can tell health officials who you've seen through this time. So don't make it a big group. And then today, later in the day, we heard the public health order becoming a little bit clearer as what they want you to do as far as getting together with just one or two households, not going to visit vulnerable people, and really keeping on this track of physical distancing and good hand hygiene and just common sense.
What concerns have you been hearing about people about this reopening plan?
I think one of the concerns right off the hop is childcare. People are asking, if I'm going back to work, let's say in phase 2 or even phase 1, if you're a dental hygienist, let's say, or a dentist, phase 2, if you're a retail store worker, what am I supposed to do with my children? There's a limited number of childcare spaces right now in the province as the restriction went from 15 to 8. It's not going to move up to 15 until phase 3, and there's a TBD on phase 3. So we don't know when that's going to happen. It could be June or July. So right now, that's one of the main concerns. The other concern we're hearing right now is if you work in a retail store, there's lots of restrictions on whether someone can buy something and return it. They're saying it's not allowed right now. People can't touch things. They can't try them on in a store. So how does that going to affect retail stores? And people unsure about if it's safe to go back to work, the amount of PPE. Today, Dr. Shahab said in the news conference that we really have to restrict the medical grade PPE to the medical uses, that shouldn't be used for someone who's not in that field. But people that are going back to work and working in close proximity, if you're a massage therapist or a dental hygienist or a hairdresser, should your clients be wearing masks? Should you be wearing masks? How can you keep yourself safe in this situation, as people are eager to go back to work, but also lots of trepidation out there? That's one of the big messages I'm hearing over the last couple of days, Sam.
Lots of things to figure out as we get into next week. Thanks so much for this, Adam.
You're welcome.